InDEPTH. As COVID-19 cases and deaths continue to grow, we are getting a local perspective from our guest health analyst, Dr. Payal Patel Davlatavadi, Associate Professor of Public Health at the University of Evansville. Dr. Payal joins us tonight live via Skype. And Dr. Payal, thanks for being here. We're hearing about the surge, the projected surge in April and in some cases in May. How much stock do you put into those models predicting the peak numbers of these cases?
Right. There have been many projections, many modeling numbers, and many states are actually predicting their peaks in mid-April to late April to early May, and these numbers seem fairly realistic. And it's again, very important to keep those social distancing measures in place, and we are practicing those in order to minimize those numbers. Some states may see as high as 200,000 to 300,000 cases. And so it's very important, again, to engage in those preventive measures, to slow the spread of disease. And the whole point here really is to flatten that curve so that we don't see a surge in cases, but rather we see cases gradually so we don't overwhelm the healthcare system.
One perception that is slowly changing in this country is the age of the people who are coming down with COVID-19. Just earlier today, CNN anchor Chris Cuomo has been diagnosed with COVID-19, and it seems as though age is not playing a huge factor, although it is still very, very dangerous for the elderly.
Yes, so the majority, again, have been the elderly, but now that we're seeing more and more cases, any age group can be affected. We recently saw the first infant death in Chicago. And so, again, this can affect any age group, any age range. The virus itself is very fluid. The situation is very dynamic. It changes every day. So everyone, especially the younger people, really need to practice those distancing measures.
And speaking of that, the tools that healthcare workers need, we've heard of these nightmare scenarios in New York and in New Jersey, but how do we stand here locally as far as getting those tools such as ventilators when and if we have this surge?
Right. Hospitals definitely need to be very prepared. I know there have been shortages of face masks and there have been donations, which have been great, but we just need to be prepared in terms of hospital beds, ICU beds, as well as ventilators, just so when our area sees the peak, we are not overwhelmed and inundated, and healthcare professionals are able to adequately provide the care to the patients.
Last week in a Skype interview, I was told by Lynn Herr with the Vanderbilt County Health Department that hundreds, her word, hundreds of tests are still out there for Vanderbilt County residents. That seems to be troubling because the numbers have been relatively low in Vanderbilt County, but the percentage of those tests would suggest that we are going to be hit much harder than we have been right here in the immediate Evansville area.
Right, yes. And again, as more and more people are being tested, we'll see more and more positive diagnosed cases. Testing began really late in the U.S., and we're just now getting around to it. So as more tests become available, especially in Evansville and the state of Indiana in general, cases are rising significantly. We will be seeing more and more cases. So again, staying at home, very important, and engaging in those preventive measures.
We have been told that face masks, that if you don't have symptoms, they really do no good for you. But there's been some analysts now who have suggested perhaps that is a good idea. Your reaction?
Yeah, so again, if you're staying at home, then obviously there's no need to wear a face mask. But if you're going to the grocery store, perhaps it could be good to wear one. Now that we are seeing more and more cases, some evidence has said that wearing a face mask can reduce your risk of contracting the coronavirus by 5 times. And so that could potentially be a good idea.
Okay, and speaking of that, preventative measures, you just cannot find hand sanitizers and soap with antibacterial agents in them in most tri-state stores right now. But what is really the key to proper hygiene and the type of soap that we use?
Yeah, so there may be some misinformation about antibacterial soaps and how that may be better. The COVID is a virus, so antibacterial soaps is really more effective against bacteria. But regardless of that, any soap will do, just because soaps in general can tear apart the virus very easily. So any type of soap will do. Just proper hand washing, 20 seconds all around your hands is what's recommended. And if hand washing and soap is not available, then hand sanitizers may be used that have at least 60% alcohol.
And really scrub your hands too.
Yes, really scrub, get in front, back, in between your fingers, under your nails. That proper hand washing is very effective. And if done properly, it will kill the virus.
All right. Dr. Payal Patel, Navla, thank you so much for joining us tonight. And of course, you and your family, stay healthy.
Thank you so much.
All right.